Well, hello and welcome everyone to another episode of You've Got the Power. I'm your host, Dr. Jason Deitch, and of course we are here with Chief Medical Officer of the Centeno-Schultz Clinic, Dr. Chris Centeno. Good afternoon to you.
Good afternoon, Jason.
Welcome everyone. As you know, we broadcast live here on the Centeno-Schultz Facebook pages every Mondays. We're on the Regenix Facebook page every Friday, answering your questions and sharing with you what you can do to take back your power, to understand how your body works, how it ages, hopefully gracefully, and what to do about it when things may or may not be going as well as they should and could. How do you navigate the healthcare system to make sure that you are at your best? Today's topic is asking the question, does a partial rotator cuff tear grow and get bigger over time? Dr. Centeno, what do we need to know about rotator cuff tears?
Yeah, so it's interesting. There's been some back and forth research for a while, but recently, and I blogged on this, some researchers went ahead and they put together the results of 4 different studies in what's called a meta-analysis. That means you kind of take all of the data from 4 different studies, lump it together, and reanalyze it. And basically what they found was that, sure enough, partial rotator cuff tears do get predictably bigger at a certain rate every year over time. So, I think what this clearly discusses and opens up for conversation is, when you get identified with a partial rotator cuff tear, should you be getting that treated as soon as possible, or can you wait? How long can you wait? All of that stuff now becomes important to talk about because a meta-analysis is kind of the king of studies, meaning that it's usually considered level 1 or the highest amount of evidence we have. So I think it's something to really talk about today is, should you wait on these things? Should you have procedures right away? Who can wait? Who can't wait? All that kind of stuff.
Let's get into all these things. I know if you're watching, you're at home, you may have suffered from a ache or pain in one of your joints before, you or a loved one, somebody that you know. And the question we're always asking ourselves is, will this just go away? Can I wait? Can I just lay off it a little bit and just, let time heal it? Or is this something that with early detection, we can actually address a small problem with a small solution, as opposed to doing probably the most dangerous thing, which is just hoping it'll go away, and it doesn't. So let's break that down, Doc. What type of injuries do people need to be paying attention to that they should be coming on in early on? What, if any, injuries can they wait and give it some time and see if it's going to be okay on its own or not?
Yeah. So what this study showed was that these partial rotator cuff tears get predictably bigger 5-10% a year or so, depending on which study you looked at and where you were on the curve. So really what that means is if someone diagnoses you, let's say, with a 25% rotator cuff tear, then you may have some time, a year or so, to figure out what to do. Because from a regenerative medicine standpoint, where we start to get concerned is when we get to these massive tears where it's completely torn 100% through and through and then retracts back, because that puts you in a different category. In addition, if you come in with a small partial rotator cuff tear, then you're more in for a PRP injection, which should help you just fine. But if you've got a larger rotator cuff tear, then you're going to head more towards bone marrow. And then again, if it's completely torn and retracted, i.e. 100%, and pull back like a rubber band, then you're not at all an injection candidate and you've got to get surgery. So really what the take-home message here is if you've got a very small tear, you can wait a while, but don't wait more than a year. And if you've got anything larger than, let's say, a 25% tear, then waiting could put you in a completely different regenerative medicine injection category to treat that rotator cuff without surgery. And obviously, if it's big enough to start with, you could end up with a complete tear that's retracted and need big surgery with high failure rates. So really the take-home message was, once you got a rotator cuff tear, small ones can wait a little while. If they're bigger, probably time to get something done.
It would seem that if what I'm hearing you say is that, if I'm going to say go upstream a little bit. Somebody's got pain in their shoulder, whether it's chronic pain or an injury that they know it was a particular event. Is if it doesn't go away, over what period of time they should be getting some sort of imaging to find out if they have a tear? And then when they get a report back that says, yes, confirmed tear, I guess the question is, if you've got a tear, why would you wait? I mean, they don't, if there's an actual tear, are they healing by themselves in any cases, or are you really just delaying the inevitable? And I'll add to the confusion, how much does a person's activity level matter? If somebody's at home and they're, knitting or not doing very much, does that change the answer as opposed to somebody who maybe likes to play tennis or is active in a repetitive motion, event, work, or whatever it may be? Does that matter as well?
Yeah, so as far as activity level goes, that wasn't studied, but I think it would be common sense that if you've got a higher activity level, you're more likely to increase the tear than if you've got a lower demand on the tendon. As far as why would you wait, literally, I think let's start with, you've got shoulder pain. So one of the things you can do at home to see if it might be more of your rotator cuff is what we call a drop test or an empty can test. So you bring your arm out like I've shown here, and you first bring it out straight out, and then you bring it a little forward, and then you point your thumb down towards the ground, and then move it up and down. Now, if that's really painful, that's more your rotator cuff. And then you test it the other way with your thumb up and see if it's any different. Now, if you've got more of a rotator cuff problem, the thumb down position will be harder to do or more painful than the thumb up position. And that's called an empty can test. Now, if you can't do it all, that's called a positive drop test. It just falls. But that's unusual to see unless you've got a massive rotator cuff tear. So if you've got that kind of shoulder problem where you're getting pain and you do that simple test and it ends up causing you more pain, then that's a good time to get it checked out. And getting it checked out could involve, obviously, a physical exam, would also involve things like ultrasound. If you go to the right doctor can ultrasound it right then and there to try to see if it looks like a tear. And many times that might be it. The diagnosis is made right there. Sometimes they'll send you for an MRI, but they're going to give you hopefully some percentage, or you should ask for how big is the tear? Give me on a scale, doc, from 0%, meaning none, to 100%, meaning totally torn, of where this lives on that scale. And if the answer comes back 20%, you really shouldn't wait. But if you needed to wait for some reason in your life, you could wait a couple months or 6 months to get that really treated. And then if the answer comes back, it's 40%, then you should probably just sign up and get it treated. And what are the treatments? Again, if it's more of a partial tear, smaller, then that's PRP. If it's more of a partial tear but larger, that's more bone marrow concentrate. And then obviously if it's full thickness and retracted and pulled back like a rubber band, which is really the minority of these, then that's more of a surgical issue.
Let's go into what their options are. I know those are sort of the orthobiologic options, but what else might somebody consider? You go, okay, I got a tear that you want to get confirmed to make sure what your injury is. But if they have a tear, you mentioned physical therapy and some other things, just so people can get an understanding, what are all of my options? And then we can get into what are their best options and why. So what else would they consider? I guess either that's popular or has any research behind its effectiveness.
Yeah, so physical therapy has, if you've got a small partial tear, going to physical therapy is a good first choice, because if strengthening the rotator cuff, and it's usually in people that aren't very active, can make a difference, then that's your first choice. Obviously, that's the least invasive thing, because we always talk about this ladder of invasiveness, from least invasive to next up and then most invasive. Obviously, if you do that and that's not making much of a difference, then it's time to start looking at orthobiologic procedures, the PRP, bone marrow concentrate, ultrasound-guided directions or injections directly into the tendon to promote healing. And obviously, if those things don't work at all, then you can consider surgery, with that being the most invasive thing that we can do to your shoulder.
Are steroid injections recommended by primary docs often, or?
Yeah, it's a very good question. Commonly they are. The biggest problem with that is we know that corticosteroids inhibit tendon healing. So they're powerful anti-inflammatories, but they're not going to help that tendon heal. In fact, they're going to go the other direction. So it's a very good point, a very, very common recommendation that family doctors will recommend and want to do. And that's where you as the patient need to say, no, not interested in that. I am going to go the regenerative route rather than injecting something into my tendon that's going to harm its ability to heal but make me feel artificially better.
I'd like to pause here just for a moment, because this is sort of the learning moment, if I may, for everybody out there. Most people think that your pain is your problem. And it's understandable to say, well, my pain is what's stopping me from doing these things. And so if I can get rid of the pain, I can get back to doing these things. Perfectly logical in the short term, but absolutely wrong in the long term. And that's what Dr. Centeno is basically explaining, that if the pain was the problem, then taking a painkiller or an injection to get rid of the pain temporarily, if the pain was the problem, that would be a solution. But it doesn't correct or heal the issue. It temporarily relieves the pain, fooling you into thinking you're better. And when you're fooled into thinking you're better, you're typically going to go back and do the activities that in many cases, if it was chronic, caused the injury to begin with, and it's going to get worse. In simple terms, drugs do not help your body heal your rotator cuff. They may, at best, temporarily reduce the pain and inflammation, but please confirm, the science, the studies, and the history show that there is a cost, that in fact the degeneration of your joint will accelerate after the use of these types of steroids. Doc, do you want to break that down a little more? I think this is one of those sort of, fork in the road type decisions. That's the difference between those people that go, I'm going to take back my power and do what's going to help me heal, versus, I don't know anything, I'm just going to let the doctors tell me because they're the doctors and I'm not. And if they say this might, quote, work, I'll do it. What do people need to understand about the truth from an actual medical doctor himself?
Yeah, again, there are, so the high dose steroids that can be injected are potent anti-inflammatories, but we also know that they can hurt the healing of the tendon. So that's the reason not to use them. And now, listen, there are times, maybe 1 in 100 where they might need to be used because there's nothing else you can use. But that's much more rare. But when it comes to the routine use of high-dose corticosteroids, they get used not because they're the right choice, 99 times out of 100, but because they are covered by insurance and they're there and they're inexpensive. And they'll generally get the patient out of your office for a while. The problem, what we've seen, is not only do those high-dose steroids inhibit the cells that are trying to heal the tendon tear, but we also know that they can have other effects as well. So bottom line is that's why you may find yourself in a situation where you have to back the doctor off to say, no, I don't want a steroid shot in my shoulder. I'm going to look at other options here to try to heal this, because you're not going to get to healing with that high-dose steroid shot.
That is essential. Thank you for sharing that. And I hope you at home are getting the nuances. This is where your power is, folks, is understanding the difference between temporary pain relief and finding and correcting the cause of the problem, using your body to heal your body. And those are two completely different pathways to get you where you want to go. If you don't know where you're going, you don't know which pathway to take. And too many people take what Dr. Centeno just mentioned, which is the, oh, you mean that's covered by my insurance? Well, let's just do that one, only to end up in a place that's not exactly where you wanted. You may have theoretically saved some money in the short term, but it's going to cost you a lot more agony and more later on when you find it doesn't work. Let's head on over to questions. Here we go. This was submitted in advance by Carrie Wilson, who asks, for people who should not have surgery, are there any non-surgical treatments that actually work?
For people, I'm assuming we're talking about for this condition.
I'm assuming that.
Yeah, so yes, we have a randomized controlled trial that has been done on PRP that shows it's effective for small partial tears. We just published a midterm analysis of a randomized controlled trial for bone marrow concentrate to heal larger rotator cuff tears, sorry about that. And we also have completed that, and we're just waiting for the last patients to get through the pipeline, if you will, before we put out the final results, but the results look excellent. So yes, there are two options. One would be a high-dose PRP injection directly into the tendon by a physician that's experienced using ultrasound to do that. The other would be bone marrow concentrate for bigger tears, but we know both those things work. Now, interestingly, for partial tears, when even though we beat physical therapy in our randomized controlled trial, surgery couldn't beat physical therapy in their randomized controlled trial. So it's interesting, even though surgery is sort of the gold standard, it couldn't even beat physical therapy in the efficacy of treating a partial rotator cuff tear. So pretty interesting research there.
It is. And what viewers should understand is that just because it's the most popular procedure does not mean it is the one that has the most science and research and data behind it. That's confusing for a lot of people because the assumption is, with so much focus and so much interest in research and science, you would think that 2 + 2 = 4. If the doctor's doing it, it must be because that has the most research and science behind it. And you're saying that is
not
true.
Exactly
the case.
So, and it's very regrettably all too common, right? These procedures got grandfathered in. They weren't really put into the insurance system because we knew they worked, but they were being done at a time when less research was required to get it covered by insurance. Now, after the fact, the research has been done showing that they're not real effective, but they continue to be covered because of institutional momentum.
And that's where you've got to get your power back. All right, let's keep going to some questions. This is from last week following over. I'm not sure if we got the results back yet, but Adrian Cuvion Barnhill is asking, while the Regenix stem cell support formula is unavailable, should we get our own ingredients for now and look for the quote recommended dose, even though that's widely varied for some of the ingredients? Did we get an update on the stem cell formula?
Yeah, I still don't know when it's going to be back in. What we have is a little piece of paper we put out a while back that has which supplements are in there, and if you wanted to do this on your own, how you would do it. So if someone wants to send me a message, Carol can monitor for that, and we can try to get that list to them.
There we go, Adrian. Thank you for your question. I know we're working on getting that back in stock as quickly as possible. She goes on to ask, should we wait for improvement to plateau post-PICL or any stem cell injection in order to get the maximum benefit from the first one before we repeat it?
No. Well, listen, there's two ways to approach that, right? One would be to give it some time. We're currently recommending 3 or 4 months, which is usually when people are reporting improvement. Now, the only downside or problem or issue I see with that is that you could be waiting a while, 6 to 9 months, before you see if you've gotten maximum improvement. It's not, the hard part is I usually get pushed on the other end, right? I usually get pushed on, I've had this for a while. I want to get rid of it as quickly as I possibly can. How do we do that? And we usually pull people back and say, listen, we could do this once a month for 4 times, but we really need to give it 3-4 months to see if it's working before we go on to a second or third procedure. Now, it's possible to do it the other way, is to wait, let's say, 6 months to see how much relief you get over that 6 months and then pull the treatment on a second procedure. I think you can wait too long because it seems like it's much more rare that this is a one and done. So anything more than 6 months is probably waiting too long.
Great question. Thank you very much, Adrian, for asking. Sean Sutton, new name. Hi, Sean. Welcome. I recently was diagnosed with shoulder impingement and small rotator cuff tears. 4 months of PT with some improvement, but not great. 3.5 weeks ago, I had my PRP injection using ultrasound at Regenex doctor in Pennsylvania. Increased pain and weakness first 2 to 3 weeks. At what point should I see less inflammation and an increase in healing? Follow-up is Friday at 4 weeks. Thanks.
Yeah, so literally with this type of procedure, I don't even usually ask the patient where they are until that person gets to 3 months. If you look at tendon healing studies, things like lateral epicondylitis, where they follow patients, same thing with our research on rotator cuff. 1 month, some patients will respond. 2 months, more patients will respond. By 3 months, you've got almost everyone who's going to respond who will respond. So I think that's probably a good way to look at this. Still probably too early. Now, if there's still severe pain, that could be an issue and something the doctor needs to take a look at. But if it's more just mild discomfort because they stirred it up, then it's probably still on track for healing. But I'd expect by 6 weeks, you wouldn't have much impact from what was done. You may not have maximum outcome, though.
All right, she's got a follow-up question here asking, why is 6 months plus too long in between injections? Does it impact the success of the injections building on each other, or does it just delay our ultimate recovery unnecessarily?
Well, it's a little bit of both. And this is more theory now than anything. For instance, with regenerative injections, the thought is that you want to continue those cycles one after the other to maximize the healing of something like a ligament. The problem being that you could make some progress from round 1, but that progress wouldn't be enough in some patients. And then the normal wear and tear process might set that person back. So you want to get ahead of the curve, if you will. You want to get regeneration to exceed normal wear and tear so that you can gain ground. And the problem is that in some people, you might lose ground.
That is an important part. I know we refer to those sometimes as boosters in order to continually boost or accelerate the results. And it's an important, that's why you want to work with an expert doctor who doesn't rush to just do more, but understands the natural processes of how do you really accelerate the body's natural healing. All healing comes from the body, comes from nature and these processes. And expert doctors understand how do you sort of maximize the body's ability to heal itself and do as little as possible to get the most healing out of your own body, because that's where all healing comes from anyway. All right, as we wrap up, we've got a comment by our regular viewer, Doug Smith, who says, I belong to a healthcare sharing ministry, and I'm glad to report they paid 100% of the cost after deductible of his knee and shoulder treatments at Regenex. And then he goes on to say that for his shoulder treatment, it took about 6 months for his shoulder to feel much better. As we come to the half hour, do you want to explain a little bit about Regenex coverage and the ability people have to have their procedures covered? And any comments you want to make on Doug, and closing comments on rotator cuffs?
Yeah, well, Doug, thank you for that information. So we do have coverage through various sharing ministries. and that's through Regenix. So we have coverage directly, mostly through employers, but also through several sharing ministries. And yes, they will cover things like this shoulder procedure, a knee procedure, etc. So that's something to consider. If you're looking for how to get coverage, you might want to look at one of those sharing ministries that are out there. Outside of that, we are contracted employer by employer and employer. So that is trying to see if your employer has decided to extend coverage for this. And we're constantly adding new employers, talking to Fortune 100 companies, talking to Fortune 500 companies, etc. So that's all the good news. But yes, there is coverage out there. Obviously, we don't have widespread coverage through things like Blue Cross Blue Shield or United. We're working on all of that, but company by company, this is covered.
That is a fantastic thing. Adrian goes on to say that she's looking forward to scheduling PICL number 2 once we get answers on not needing repeat DMX for each PICL. That was asked on Friday. Do we have
so
let's
update on that. So there was a limited DMX that was being done early on as part of a study we were performing. And Dr. Schultz had continued to do that even after I had gotten the sense that we were done with it. So the X-ray exposure for that limited DMX was less, meaning all they were doing was the C1, C2 overhang. Also because the provider obviously was doing those for free. And the provider was trying to reduce their time, and we were mostly interested in C1, C2 overhang. So Dr. Schultz has now stopped that practice. I think we have enough information there that we don't need to be asking patients to do that unless we're really interested in trying to see what's going on, and there's no other way to find if we're making actual improvements in the patient. So that's the update from Friday.
All right, that sounds to me like a case-by-case basis, and talk to either you or Dr. Schultz individually as to what's necessary on a per person, per case, per situation basis.
Correct.
That sounds great. Adrian, so green light on scheduling your second. You got it. You're welcome for clearing that up. She says thank you. Doc, let's close up today's show, and I'll say goodbye afterwards. What do people need to know about partial rotator cuffs? And hoping they'll just go away. They don't. Tears don't heal by themselves. What do they need to know about taking action sooner rather than later?
Well, listen, if it's a small tear, as I said, physical therapy is always the first step. If it heals and the pain goes away, that's great. If it doesn't, then I think what this most recent study shows us is that we should go ahead and move sooner rather than later, especially if the tear is bigger. Because the longer you wait, the more likely it is to get moved from one category into the next, from simpler PRP into more expensive and more invasive bone marrow aspiration procedures, from that into big surgeries, etc. So it's like anything else, small problems, small solutions. Bigger problems need bigger solutions that have a higher likelihood of something going wrong.
There you have it. We thank you so much for joining us on Mondays here on the Centeno-Schultz Facebook page. We'll see you Friday on the Regenix Facebook page. If you want to know if you've got coverage, go to the website regenixcoverage.com, and you can find out if you're one of the up to 8 million people who have employers or sharing ministries that offer this coverage for you. You may have coverage right now for your next Regenix procedure. And as we close, I'll just ask on behalf of Dr. Chris Centeno and myself, please share this with other people. We know there's lots of people suffering who just don't know where to go, who to turn to, and they end up on this traditional path of going to their primary doctor, finding out that these dangerous drugs are covered by their insurance, but they're free, or according to the patient anyway. So they go down the path, they end up letting their problem get worse over time. You hear us say this every single week. Small problems, small solutions. You let them get worse over time, which they will. It's going to cost you more and take more to heal it in the future. So, you now know you have the power to make the right decisions. Find out if you've got coverage. Get on in, whether it's through telehealth or into the practice, to find out what you can do to take care of yourself sooner rather than later. On behalf of Dr. Chris Centeno, I'm Dr. Jason Deitch. Thank you for watching. We'll see you Friday on the Regenix channel. Thank you for sharing this program with everybody that you know. Until next time, stay well, be kind, and thank you for watching.